For 1 in 6 Canadian couples, having children is a challenge. There are a number of factors, but whatever the reasons, struggling with infertility can be devastating. This week is Canadian Infertility Awareness Week, so we've asked 2 experts to come talk about it. They co-wrote a book about how you can increase your chances of starting a family. We've got naturopath Tanya Wilde joins us, as well as Timea Belej Rak. I hope I said that right. Yes, thank you. So congratulations on the book together. You both approach this from different perspectives, but why did you want to do it together?
So I'm a traditionally trained Western medical doctor. I am an obstetrician gynecologist with specialty training in infertility. And even though I still treat my patients mostly with the traditional Western medical treatments, I noticed that they were having success with other modalities such as acupuncture, naturopathic treatments, coaching, counseling. And so I decided to approach these practitioners and collaborate with them. And I have found that that has helped my patients achieve greater success. And I also believe in empowering my patients, which is why we decided to put the book together and empower our patients with all the resources that they have to conceive.
And hopefully we'll inspire other medical doctors and naturopathic doctors to work together and other holistic practitioners just to help patients feel really supported and in addition to educating everybody on fertility.
All right, so let's dive right in. Let's talk about timing.
Okay.
When is the right time for a couple to seek the advice of a doctor?
So age is the #1 factor for women because we are born with all of our eggs, unlike men who produce new sperm every 3 months. And therefore, we advise women to seek help if they've been trying for more than a year, if they're under the age of 35. After 6 months, between the age of 35 and 40, and then over 40 within 3 months. However, in certain situations, such as single women, for example, they come to see us right away because they need help right away. As well, if women are having trouble with intercourse or men with ejaculation, then we would be willing to see them much sooner, as well as if a woman has had surgery, for example, that might affect her ovarian function, and same with men in terms of any testicular surgery or anything like that.
Tanya, any other factors affecting fertility that we should list?
Yeah, so caffeine can be a factor. Anything more than 150 milligrams a day can actually increase your risk of miscarriage. Obesity is a big one, so just losing 10% of your body weight can actually really increase your chances of pregnancy. Pesticides can literally kill your sperm and your egg quality.
So it's really the modern world. You're really saying we got to be aware of the modern world.
Yeah, like even laptops and cell phones, keeping them away from our, men's testicles. So like, having your laptop up here. Sugar. Sugar is the biggest one. Or I shouldn't say the biggest. Age is the biggest, but sugar is a huge one.
Really?
And it's everywhere. And hidden sugars, it's basically toxic to our ovaries and our sperm. And it
processed
can really
sugar, right?
Processed sugar. Yeah. Well, even sugar is sugar, regardless, even honey. But sugar is sugar, I always say, and it's often hidden. So even choosing, for example, whole grain brown rice versus white rice, because white rice, converts immediately to sugar.
Doctor, you've said that there are some pretty important tests that one can take to determine fertility. Can you walk us through that a little bit?
Sure. So one of the most important for women is called follicle-stimulating hormone. It's usually done on the 3rd day of the cycle, and it tells us kind of how the ovary is listening to the signals from the brain in terms of the egg production. Another one is called anti-Mullerian hormone, and it gives us a sense of how many eggs a woman has in terms of her lifetime reserve. For men, of course, we need to check whether there are any sperm, in fact, present, although sometimes it's more difficult to get them to come in and actually do the test. And then there's a more advanced way of looking at the sperm called DNA fragmentation, where it actually looks for damage in the chromosomes or the DNA of the sperm itself.
Oh, there's a lot that could be tested for.
Yes.
Tanya, we've sort of warned people about the world around them and how that can affect fertility, but what about some fertility-friendly foods, some good things to look for?
Right. So my top 3 I like to recommend is spinach, avocados, and blueberries. They're all high in antioxidants, and you can get folic acid in the form of folate from the spinach and from avocados. And there's also a lot of good fats in avocados. And generally speaking, choose organic. And again, avoid sugar, but choose whole grains versus the refined, again. So
all delicious tools to fight infertility. What about supplements, doctor?
For supplements, it's very important for women to take a prenatal vitamin containing folic acid because that's been shown to reduce birth defects and spine or neural tube defects in the babies. As well, vitamin D has been helpful for egg health, as well as coenzyme Q for sperm and egg health, and finally omega acids also helpful.
Now, as we know, as people are trying to have babies a little later in life, I'm sure this is something that is that you're noticing a rise in. But are you also noticing people taking ownership over these decisions and over their bodies more these days than they might have in years past?
Yeah, absolutely. Because we're delaying having children a little bit more, I think people are working on their lifestyle, realizing, you know what, we got to preserve our eggs, and if they're not recognizing that, then definitely when they come to us, they recognize that. But it's important to know that it's not your fault, though, if you have infertility, or subfertility, I like to call it. You can do everything perfectly, and it can still delay things, but ultimately, you know, you want to try and work on your biological self, like your physical self, to improve it as much as you possibly can.
Such an important conversation. Thank you for coming in and sharing your thoughts this morning. We really appreciate it.